Dr. Louis Arroyo is a researcher from the Ontario Veterinary College, and he has been studying equine gastrointestinal systems for many years. He's been involved in many studies analyzing the complexity of how the billions of inhabitants of the gut impact the overall health of a horse. Thank you for joining us, Dr. Arroyo.
Hello, Jackie. Happy to be here.
Can we start off by discussing some common signs of gastrointestinal disorders and talk about some of the impacts on the horse?
Yes, of course. The gastrointestinal tract of a horse in particular is extremely large, and there are many things that can cause disturbances of the normal function or health of the gut. So common disorders in horses would include, or gastrointestinal signs of disorders could include something like abdominal pain, changes in the fecal consistency, even low body condition or weight loss, for example, something like excessive drooling, constipation or reduction in the fecal production, lack of appetite, bloat in some cases, and some things that are more obvious to some people are, for example, poor performance, and then in more severe cases, something aside, for example, like diarrhea could be acute or chronic diarrhea. In terms of consequences, I mentioned, Jackie, one of the most concerning features sometimes in these cases are the effect of this gastrointestinal size on performance. So this is something that is rarely noticed. Sometimes also changes in behavior. Horses don't feel well, so they change their behavior. They are more, moody or cranky. They don't perform as well. Some abdominal discomfort or pain. Some horses tend to, for example, bite at their flank. They complain when they are putting the saddle on, for example. They don't want to perform when they are asked to do some work. And ultimately, sometimes things like changes in the fecal consistency, which can be a health issue, but can also be, an aesthetic issue for a horse that is, for example, competing or performing, and that can cause some problems during their activities. In terms of colitis, there are infectious and non-infectious causes of colitis. So we know that there are bacteria out there, for example, Salmonella, or Rickettsia ristici, or Rickettsia filiensis, which are the causes of autonomous horse fever. Lawsonia intracellularis, for example, they can cause colitis in horses, and they can be a major problem. There are also, same as colic, situations where, for example, horses eat too much sand. This can be a cause of diarrhea, and is necessarily a colitis case, because in this situation, the sand is irritating the colon, is causing colitis. As well as gastric ulcers, as I mentioned before, can be a major problem in horses, and factors like prolonged fasting, again, high grain diets with the production of volatile fatty acids, drugs like butane and flunixin, those are non-steroidal anti-inflammatory drugs. They can be a risk factor for developing ulcers. And lastly, just as colics also, or diarrhea as well, a stress factor of transportation and stall confinement can be risk factors for developing gastric ulceration.
What do we know so far about causes for each?
Let me start by saying that these animals are herbivores, they are, and they have to break down these complex sugars in the forest that they consume. The gut microbiota or microbial communities that live there are very important for their health. So we found more recently that many of these conditions like colitis, colic, gastric ulcers are closely linked to some of these disorders in terms of what are being the cause of it. So in horses, for example, let me start by talking about colic, which is the number one, for example, clinical sign or clinical condition that can occur in horses. We all are very aware that dietary changes are a major factor in developing colic. Also, for example, diets in very high on grain. This can change the volatile fatty acid that they produce, and that can be a source of a problem for developing ulcers, for example, or developing gas colic. A very rich grass diet, so changes in the spring, for example, from hay during the winter to lush grass can be a big cause of rapid fermentation and cause of colic, or the opposite, eating moldy hay, hay of bad quality. But also abrupt changes in the diets. If you change from one, even if they're eating a good diet, to a different diet, that can be a source of a colic. Parasites are well known for many years of a cause of colic in all horses. And water consumption, for example, that can be an issue, especially in countries with seasons over here, where sometimes in the fall or in the winter, when the water gets really cold or freezes and horses are not drinking, that can cause, for example, impaction colic, which is, most seen during this time of the year. In some other situations, either by accident or just because the soil is very rich in sun and invariably they will eat sand, or sometimes the horses will eat sand just as a habit, they can develop, for example, sand impactions, and that can be a problem in regions with very sandy soils, like, for example, the Netherlands or Scandinavian countries, Denmark, Finland, Sweden. But I know that this can happen in California, for example. The use of NSAIDs, non-steroidal anti-inflammatory drugs, can be a cause of colic and can be a cause of ulcers, not only in the stomach, but also in the colon. And any stress factors such as transportation or fasting, racing, can be a source of stress, can be a source of a factor for developing stomach ulcers, for example.
Sorry, just going back to non-steroidal anti-inflammatories.
Okay.
Can you talk just a little bit about how that impacts horse health?
Yes, these drugs interfere to some degree with the blood supply to some part of the gastrointestinal tract, and that can end up causing ulceration due to, impair function of the normal physiology of the stomach of the right dorsal colon, for example. And if you use those chronically or for a long term in some horses, that can cause severe ulceration.
Yeah, and what about antibiotics? We're hearing a lot about that these days.
Well, antibiotics, as the name says it, they will kill bacteria. They will kill different microorganisms. So thus they are designed for that. So invariably, when they are used, they will end up depleting some bacterial populations, including in the intestine. And that is a problem because that may allow some other bacteria potentially pathogenic or harmful to overgrow. And that can cause dysbiosis. In a recent study, for example, of Dr. Gomez and coworkers, they administered 5 days of antibiotics to horses, and they demonstrated that basically the damage to the intestinal microbiota resembled dysbiosis as a horse having, a colitis event, and that can potentially result in intestinal inflammation and predisposing to diarrhea. So antibiotics are very well known to cause dysbiosis, and in humans is the number one cause, for example, risk factor for antibiotic-associated diarrhea or Clostridium difficile-associated diarrhea. And horses are at the same risk.
How has DNA sequencing proven useful in furthering our understanding of gastrointestinal issues?
Well, honestly, this sequencing method has been a breakthrough in science in terms of understanding the communities or different microorganisms living in many different niches, from skin to the lungs or the upper airways to the intestine. So we know in general what is the population of microorganisms in terms of, how frequent they are, how many of them are in there, and that gives us a, a big picture overview of what population, for example, lives in the lumen of the intestine or different compartments. There are differences in which area of the intestine, whether it's the cecum, the colon, the small intestine, the small colon. They all vary, and they have different functions in each compartment. Or even at a more sort of like minute levels, such as bacteria that are free in the intestinal cavity versus those that lives along the mucosa of the intestine. So in general, to answer your question, it gave us a big picture of who is there, what they're doing, and who is being sort of like depleted or changed or harmed during disease processes. For example, like colitis, who is down, who is up, which bacterial communities of which families of bacteria are affected. And that led us to have a better knowledge of find out which ones are being harmful to the system and producing, for example, some virulence factors, metabolites, proteins that can further compromise the health of the animal.
Can you tell us a bit about how Robogut has been used in gastrointestinal research?
Yes, the Robogut is this fantastic system where the bacterial communities that normally lives in a natural environment are being replicated in the lab. So we originally had this great idea of replicating what is happening, for example, in the colon of a horse with colitis in the lab. So our intention was to replicate the disease process in a flask, and that's you can manipulate these systems quite effectively and quite precisely. We unfortunately were not able to zero on exactly how to manipulate the colitis cases, but some other research have gained a lot of understanding of disease processes or even therapeutic processes by using the Robogut. For example, some researchers at the University of Guelph have used it by adding supplements, for example, probiotics, prebiotics, and they will measure the metabolic profile of the bacteria that is growing in these systems, and they found that they can dramatically or markedly change the metabolites that are being produced according to what is being added to the system. And I think that's a great potential to use this system to prove concept that these systems are indeed replicating what is happening in the real life.
How are we diagnosing GI issues currently?
Well, that's a great question. We still rely a lot on the clinical history from what is being told to us by the owners or referring veterinarians about the clinical signs. And the physical examination and clinical signs are really important, in terms of, for example, motility, the general status of the whole, hydration status, and things like that. Of course, they are very important. Other diagnostic aids that we use is, for example, a complete cell count or biochemistry profile. They can give us a general picture of the health of the horse. And then we jump into some other things, abdominal ultrasound, where we can visualize the wall of the intestine. We can visualize the contents of the intestine, so we can see things such as the appearance of the contents. We can see whether the intestine is displaced, for example. In some colics, we can see that the colon is not only displaced, but perhaps the wall of the colon is thickened, so we know that there is a twist, for example. We can use also other tools like gastroscopy. So we use a gastroscope to visualize gastric ulceration, for example, in the stomach. And in some cases, we can go even farther into the first part of the duodenum, and we are able to see the damage of the erosions on the glandular or the of the mucosal of the intestine or the stomach.
Dr. Arroyo, you are currently involved in research screening for biomarkers as indicators of intestinal health among equine microbiota. Can you explain this process and what it could mean for the future of diagnostics?
Yes, no, that's a fantastic question, and we are really excited about this. I work with a colleague in Montreal and the University of Montreal in Shanghai, Dr. Marcio Costa. And basically, the dysbiosis index, as it's called, derives from sequencing of the bacterial population of in this case, in the intestine of animals. The dysbiosis index basically has the objective of quantifying X number of taxa or certain bacteria that are important to us. So in dogs, for example, this has been done in some of the species. In dogs, for example, they quantify the number of 7 different taxa of importance of the total bacterial populations. And with that, they put into a mathematical algorithm and basically spits out some results that tell us that particular bacteria is either increased or decreased. And based on those numbers, you can use a more specific taxa, if you like, to identify dysbiosis. So in terms of looking at the whole bacteria with the, with the microbiota studies that we do, with the microbiome studies, we look at more specific groups, and that will give an indication of whether or not there has been, some dysbiosis process going on. And this has been done in other species like cats, for example, and it has been used for a while. So in these cases, basically, some of the advantages of that is that it's more cost effective because you don't have to amplify it a lot. So you use a set of primate, let's say, for only 5, 6, or a number of taxa that you want to study. And a study in cats, for example, found that 6 bacterial taxa could be used to predict diarrhea quite accurately in 83% of the cases just by looking at 6 particular bacterial taxa.
Can you share any preliminary findings of this research?
Yes, of course. So we are in the middle of analyzing our data, but the most remarkable finding so far is that we found, interestingly enough, is that in horses with colitis, the whole bacterial population is very depleted. So we have a massive depletion of the communities, and then there are only a few of them that are more prevalent. At this stage, we are in the process of increasing our numbers to find significant differences in which bacterial taxa are more important. But we will be sharing with you very soon which of those bacterial taxa are more promising as predicting dysbiosis in horses with gastrointestinal disease.
And as I understand it, one of the goals is to create a rapid PCR test.
That's correct. So the whole point of this is to create a test that you can submit samples to the lab, or in the future, like in humans, a stool site test that you can run a quick PCR, as you will do to detect, let's say, salmonella or other things that can basically predict some of these outcomes that we're looking at, for example, diarrhea. It can be used in a clinical setting for sure.
In closing, can you share some top tips for protecting a horse's digestive health?
Well, this is a great question, and generally speaking, I start by giving a general recommendation for a healthy gut that might include providing an adequate amount of fiber. Remember that horses are fermenters; they need fiber. It's very important to their function. Prevention of abrupt dietary changes. These changes can be quite harmful for the microbiota and the health of the horse in general, so gradual changes are generally preferred. Also preventing or avoiding large grain meals at once. So spread it out as much as possible. Large, highly fermentable diets can be quite harmful to the microbiota, can also be a source of risk for developing gastric ulcers. Also prevent long periods of fasting. Fasting is not good for horses. Horses are continuous grazers, and so they need to have smaller amounts of feed at all times that they can be, munching away or eating their meals in constantly, rather than a big bulk amounts at once. And of course, always in a fresh water, available at all times, that they can drink and be well hydrated and maintain good moisture of the contents in the gut. So for good mixing and proportion of the contents to the gastrointestinal tract is very important. Other important things are like good dentition, for example, good teeth, to check them from time to time. Exercise is extremely important. Horses need to move around. So those are basic tips. I think that they will keep the horse happy, and it will keep the gastrointestinal tract functioning properly.